Thanks very much. I suspect that there will be a whole list of questions from my fellow committee members. So this time around, I will not invoke the chair's privilege. I will, let the questions come. Erin.
Thanks very much to the panelists. I think this is for Jonathan mainly. You talked a lot about the resiliency with the generic drug industry, but just 2 days ago, we had Teva closing their Irvine facility. We don't know the list of medicines made in that factory. We know there will be shortages, but we just have to wait to find out. What is being done to improve the resiliency of the fill and finish of those facilities?
Well, we don't know what shortages. I mean, we don't know how competitive that marketplace is for those products coming out of the plant. So I don't know about the shortage. But as far as the resiliency of fill and finish, one of the things our companies are, when I say our companies, our member companies, so the generic industry, is they're looking at their supply chain and making sure that they do have the inputs in place, and they're tracking their supply chain and seeking greater number of inputs. Prior to COVID, through their drug master file, they may have identified 3 or 4 different API producers, for example, but they may only be taking the vast majority of that API from 1 or 2 companies. The companies that I'm talking to now are looking at, okay, how do we diversify the number of where we're actually importing that API from? And so they're looking at, okay, as we bring products into fill and finish, how do we ensure that we've got ample redundancy in our own internal supply chain? Now, when it comes to the fill and finish, I mean, I don't know, I can't speak to the situation at Teva, but I can tell you our companies have redundancies built into their own supply chains, and they will be looking for ways to fill the quantities that were produced there, I would guess, from the Teva. But from the perspective of our industry, the way the contracts are done in the generic space is there's always competition, and people are looking for ways to supplement. So there, I imagine the market will fill in any places that are that may be needed. But so sorry, I can't really address the Teva point. So I don't.
Other questions from the committee? Okay, well, I've got plenty. So maybe I could ask all of the panelists to respond, to the following. Our previous set of panelists, sort of acknowledged that some kind of greater international agreement to limit export bans or constrain export bans could have merit, but they pointed out, that it could be very time-consuming and difficult to negotiate. Right. It sounds like all 3 of you are in favor of an international agreement that, makes this kind of behavior less likely. How would you, respond to the, notion that it's going to be hard and difficult to negotiate, right? I mean, how would you sort of make the argument that it would be worth, the investment of government officials' time and resources to actually get this done? And Jonathan, maybe we'll start with you, since your organization seems to have come down, pretty firmly in favor of something like this.
Well, I agree. I mean, I think it will not be an easy negotiation, but in a sense, the current environment we're in demands this. I think it's not just the United States looking at how to secure its supply chain. It's our allies around the world are having these same debates and same questions. So I think at first we can agree with our allies that there is the common goal of having this greater coordination and cooperation. I like how Chad was talking about, there's areas for cooperation in terms of investments. I mean, we look at comparative advantage, and there's definitely markets where there'll be more comparative advantage to invest in certain production facilities based on where the raw materials are coming from. And so that's something that we should benefit from. But I do think the challenge is, no one would have thought we would have had a vaccine in a year. Now, clearly a different issue, but I don't think the challenge is too great to begin having these conversations, because these discussions are happening around the world, and our allies are all asking these same questions. So I would encourage the U.S. government to move quickly and begin those conversations.
I guess what I would say, Lee, on that question is if you have the ability to do these export bans in place, then I think what Scott has rightly pointed out is firms won't undertake the investment necessary to scale up production because they're going to say, I can't get the stuff out. Why am I going to invest in building this capacity? Because I'm going to be constrained in what I can sell into my local market. At the same time, I think you're going to have government policymakers, the local government policies say, why would I subsidize to build out that capacity if it's just going to be exported and the vaccines are going to go to people in other countries, right? So there's kind of a fine line, I think, to balance here, that all of these things have to be taken into consideration. You can't just have probably a focus on banning exports without getting coordination with other countries on they're also subsidizing and scaling up through public funding the supply chains to produce, to make sure that in the end of the day, with all of this, we get an equitable distribution of whether it's vaccines or PPE or whatever you're talking about at that particular moment.
Yeah, I totally agree. And let me maybe just stitch the two previous sets of comments together. Because of international comparative advantage, it's really in our best interest if, different ingredients and materials are produced where it's most efficient for them to be produced. But without a strong commitment to enable trade in those inputs and final products when they're produced, we're not going to see the right investment, both in any individual location or globally. And so it's in the US's strong best interest to have production of vaccines and PPE and everything made in the places where it is most effective, because that is the highest throughput, the highest total production value, and protects us the most. And again, right, I'm not an international treaty negotiator. I have no experience with doing this. I'm certain it's extraordinarily complex to do, especially when you're talking about something as fraught as ensuring the ability to export goods in times when you might need them yourself. First of all, it's super important to make it clear that precisely that commitment is what also ensures that you will have the things you need that when you need them. And second of all, that those commitments are worth a ton. Again, we're talking about trillions of dollars here. And so you want to be able to incentivize the upfront tens of billions or even 100 billion of investment to avoid, to offset the $1 trillion risks.
Thanks very much to all of you for your comments. Tony, once again, to my fellow committee members, any questions, comments, reactions to what the panelists have given us? Yeah, anyone? All right, so I think we may be reaching that point in the afternoon where people are experiencing that post-lunch lull in attention. But I drank extra coffee before this session. So if I could turn, briefly from, consideration of the shortages and trade frictions associated with the pandemic to, what I might refer to as the more recurrent or chronic shortfalls of supply, especially of, sorry to put you on the spot here, Jonathan, generic drugs, right? So, I think I'd ask you to address this, right? Would your organization, be in favor of particular trade policies or related policies that might help ameliorate some of these more chronic or recurrent supply shortfalls? Of course, it's not, something that characterizes the entire generic product space, but there are particular pieces of it where we have seen this. So I'd very much appreciate your response to that.
Sure. And I think a lot of the shortages in the marketplace are as much about market failure here in the United States as it is about the supply chain. I think it was noted earlier that, it's a very low margin industry. And the way our market is set up is that there's a lot of pressure to have lowest price possible and downward pressure, even if you're stuck, even if a company has a contract for multiple years in a row where that contract is in place. There's often a clause in that contract that if a lower price product comes in, you have X number of days to meet that price or you lose out on that contract. And so this continuous push of prices down farther and farther has some situations where companies actually are unable for profit reasons, for sort of margin reasons, to continue producing that product, and so actually will stop production of a product. And so we see some shortages related to those market conditions. And actually in the 100-day assessment of the supply chain by the Biden administration, they note these market pressures have on those issues. So I think identifying and solving some of those basic market challenges in the US could have a long way of promoting some more sustainability in the supply of medicines in the United States, and some of the shortage issues that you've noted in the generic industry.
Thanks. Any questions or comments from the committee? Yeah, so Chad, in your remarks, you suggested that if we're going to have an international trade agreement in this space, I mean, this is kind of switching back more. Oh, sorry, Aaron, you had a question. I'll go ahead and turn the floor over to you.
No, you're doing awesome, Lee. Thanks for your questions. I guess when this panel started, Jonathan led with kind of a discussion about maybe we don't need as much transparency. Okay. I just wanted to clarify.
Disagree with that.
Okay.
In the CARES Act, which also gave the impetus for this work, the FDA was asked to begin collecting a source of API. Where is the API coming from? And this is something we as an association fully support. We would have liked to have seen that enacted by now. And we are encouraging the FDA to obtain whatever they feel they have to obtain from Congress, the authority to actually begin collecting that. So I would fully, we are behind increasing transparency and having a better understanding of where the supply chain is coming from.
Thanks for clarifying that.
Yeah, can I just weigh in on the transparency thing too? And of course I'm biased because I'm an empirical economist, and without data, I don't exist in the world. But I would just point, whenever you hear, and I'm not saying you said this, Jonathan, but I'm reading this in the semiconductor space that's coming out now with Commerce's requests for additional transparency, companies complaining about not wanting to have to turn it over. I mean, in the case of what we're talking about here, we can come up with ways to compensate folks for becoming more transparent. I mean, just look at Scott's numbers about how big the losses are that we're talking about here. There is so much money left on the table that if companies are worried about becoming slightly less competitive because they have to spend a little bit more to provide information to policymakers so they're making more informed decisions, there have to be ways that we can compensate for that, to provide for that information that's just so valuable.
Pausing again. Okay. Not trying to monopolize the conversation with our knowledgeable panelists at all. All right. So, Chad, you were stressing in your remarks, right, that, there needs to be a stronger international trade agreement in sort of the, pandemic related, drug device vaccine space, right? But you are also strongly pushing the idea that in addition to a trade agreement, there needs to be an investment agreement, right? That would allow us to make the, as an international community, that would allow the member nations of this treaty to coordinate investments, right? And to share information. Now, of course, this would make an agreement that combines both trade issues and investment issues, perhaps even more challenging to negotiate. But you're very strongly arguing for synergy between the two. Could you tell us a little bit more about the investment side, right? What the investment side of this treaty or agreement would look like? Are there precedents that we could build on? What would need to happen for that component to function as you wish it would?
So these are great questions. haven't been able to identify. There may be some out there, some other precedents that have done this, I think. But let me talk through why it's hard. So normally we don't do this kind of cross-country investments for rich countries, right? So if we're thinking about, the development bank, say the World Bank will help fund, do public-private partnerships in lots of developing countries around the world, but this isn't typically a phenomenon that we'll see in rich countries in normal times. But I think the pandemic has shown why it's potentially useful. And again, the priors are the supply chains are global. The input providers that I need to have access to, that my manufacturers need to have access to be able to scale up their production, may not be located in my country. So I need the foreign government to subsidize those input manufacturers, whether it's bioreactors or bags or cellular or whatever, if I'm going to be able to scale up my production facilities, but I don't have a direct fiscal mechanism myself to be able to do that. So you need to have some sort of cooperation here to be able to do it. Now, how to pull it off, I'm not sure. I don't have a template in mind, and I'm always hesitant. I'm married to a lawyer, but I'm always hesitant to allow lawyers the reins to kind of negotiate over these things. But you can see why, in the absence of this, there is a lack of sufficient subsidies. United States, the Trump administration, to their credit, did subsidize kind of the full, for the most part, vaccine supply chain. But I think they did it, with the American production base in mind. And we don't have access to all this great data, but from what I would one of the things that I did, and let me just talk briefly about this. When this Indian fiasco that Scott mentioned back in April came up, right? So the Indian CEO claimed the Biden administration had an embargo on vaccine inputs. Nobody knew anything, right? And eventually the White House shipped them some stuff that it had laying around, right? Was there an embargo? Was there not? What I managed to do was to track down some data. It's called bills of lading data. That was put together by a private company called Panjiva, and they were great and willing to share this with me. But what it basically allowed me to do was to look at what the Serum Institute of India and Biological E, these major vaccine manufacturers in India, had been buying from foreign entities over the last year. And so anything that gets imported into India, they have to fill out paperwork, and it's not just for us trade geeks. It's not just the product level HS, harmonized system codes. These are actually descriptions of the products that they're purchasing. And they digitized all of this data. I could look at it and see, oh my gosh, the Serum Institute has actually bought, this brand of whatever bioreactor from, this company. And I could then Google it, see how much that thing cost. Yep, it matched the numbers they were saying there. But this basically made the point that there was never an export embargo by the United States. It was simply that these Indian companies weren't able to access as much of these inputs as they wanted to, right? So there was clearly a bottleneck here that it took the Indian CEO on Twitter to have to call out the Biden administration for them to, put together, to address, right? And we shouldn't have had that happen. We should have mechanisms in place to kind of allow that transparency, to allow the scaling up of the production, to know that the Indian firms would need those inputs just as much as the companies in the United States and Europe were going to need them as well, to make sure that that wasn't actually holding up production. So I think there's just huge lessons that we can learn from these experiences, ingrain some of them as guardrails into trade agreements, because what trade agreements largely do is they create playbooks for how to, in sort of best practices for how to respond when different things come up. And so if we take these lessons, try to apply them into some kind of written framework, I think it could potentially be quite useful the next time around.
Totally agreed with all of that. Let me just quickly jump in on the mechanism point as well, if you don't mind. So one thing you could imagine as a beginning of a mechanism, I think there's going to be a better way to enshrine this in a formal agreement with sort of committed subsidies in the form of a treaty or some other sort of international agreement. But a beginning would be to have advanced purchase commitments for individual inputs or or products, alongside a commitment not to not to harm trade and exports. Right? An advanced purchase commitment says, I'm going to commit to buy this many bioreactors, this many bioreactor bags, whatever the case. If the company that manufactures those bioreactor bags in another country is certain that they will in fact be able to export them in the event that they're needed, right? In the event that that purchase commitment is called, then they will invest in the capacity to produce. Again, this is not as good as direct subsidies. You'd rather have an international fiscal mechanism to do it because that takes even more uncertainty out of the picture. But if you wanted to get a start, you could do it with a combination of a guarantee of trade and an advanced purchase commitment.
Yeah, Jonathan, feel free to jump in here, right? Academics and government officials are, considering policies that will mess with your industry. If you have any reaction, please feel free.
Well, my reaction was actually to be supportive of what they're talking about, because I'm thinking also in India. The Indian government identified 51 APIs and related KSMs where they felt they were too dependent on China. So they're investing billions of dollars to try to actually produce some of this in India. If there was an agreement that the US and India were both a part of, where there was greater transparency and possibility for coordinating, because I think when we looked at, I think there are 11 or 13 of those products were actually on the list of essential medicines the FDA published. That is, if there was a cooperative mechanism to say, okay, these are products that are important for the US healthcare system, maybe we don't need to be subsidizing and promoting the same type of production here if that is being taken care of by another country. So I think that is an opportunity where, again, some comparative advantage can be found, as well as comparative advantage in government support subsidies. I think why that's important from the industry standpoint is it's very difficult to set up manufacturing facilities in every market that's demanding that they locally produce. And so if there's a way that the US government can be coordinating and cooperating with its allies to encourage certain industrial bases to be expanded in different markets for certain APIs or finished pharmaceuticals, that will also help industry be more efficient in where it puts its resources.
Okay, thanks for that. I'll pause again. Any questions from the committee? All right, so here's another, right? So the ambition of what is being discussed here in this Zoom call is sort of continuing to expand, right? So we're talking about a trade agreement, we're talking about investment agreement, but it sounds like at least implicitly, we're also talking about some kind of data sharing agreement, or at least data sharing rules and a data sharing infrastructure. This came out in Chad's remarks, it came out in Scott's remarks, and to some extent, Jonathan, it sounds like, you're at least implicitly, endorsing this, right? That, the world needs to know, right? What is being made where, where the supply chain bottlenecks are in an emergency, and perhaps, even in more normal circumstances. So I'd love each of you, to sort of give us your view on, what are the costs associated with this information sharing? How could those costs be met? How might we structure this in a way that, protects private interests appropriately, but also ensures that we achieve these public goals, especially in a pandemic type situation. And Jonathan, since you were the last to remark, maybe I'll ask you to be the first to respond to this set of issues.
And my answer may not sort of meet, I think Chad talked about the value of total transparency on this, because from the industry standpoint, one of the challenges with that type of fully open transparency, there's a lot of commercially confidential information. And some of the supply chain data is really, that's important for the companies to maintain that confidentiality. I think where we are supportive is the FDA as the regulatory authority, as the agency within the US government that has responsibility for tracking and alerting healthcare systems regarding shortages has that data and that information. I think from our perspective, there would be concern if this was fully open, just because, again, companies have to make these business decisions. Unfortunately, in some situations, and it was alluded to earlier, there are very few facilities that make a certain API or and so in those instances, it's, these companies are competing against each other in commercial marketplace, where again, for lowest price is the absolute sort of market determining factor. And so I think our view is there is a real need, and we appreciate that need for the regulatory authorities to have access to that information, but doing so in a way that it is open and transparent to all is probably not going to be supportive of the competitive marketplace where the generic industry operates.
Thanks. Can we get Scott and Chad to very quickly respond to this? And then we do have some questions from other committee members.
Cool. Let me actually just echo this view that there should be trusted data brokers. I think the FDA serving in that role in the United States is a great idea, but I also think there's a role for international coordination, on that side as well. This marketplace I mentioned, this pilot that CEPI sent up, which is a footnote, I and a couple of other people in the Accelerating Health Technologies group had some early advising on the initial launch, is exactly a trusted data brokerage to try and find excess supplies or supplies that are, or companies that are facing shortage, and manage sort of transactions to utilize all of those supplies to the greatest extent possible, without revealing publicly a lot of information about sort of which companies rather, and which suppliers had excess or shortage. And so, CEPI basically built a pilot. It's very much like this agricultural system that Chad mentioned. They built sort of a centralized data broker that companies could, both input suppliers and vaccine manufacturers could come to and report information about the state of their individual supply chains and sort of production levels in a way that would enable CEPI to try and coordinate and make sure that shortages were avoided without sort of producing a fully public record of everything that had happened. I think there's a lot of opportunity for that, both at the national and international levels.
Thanks, Scott. Chad?
The first thing I would say on this is to basically just hope everybody understands that Monica and sort of Carter's jobs now of these supply chain resilience task forces and things that they've had to stand up and have been on, my sense is this is the new normal, and that we should just see this as now, it's not a pandemic phenomenon, it's not a health phenomenon. It's kind of in a globalized world with cross-border supply chains. This is, and especially in a world where the likelihood of these big shocks is out there, whether it's pandemic or health or climate or political. This is the new normal, and so I think we need to be thinking about how to develop systems that can be durable and last, and that can kind of inform long-term policy. So I'm heartened that this stuff is taking place, but I would also encourage folks to think about how this can ultimately be sustained. To this question about data, and also I agree with Scott. I think what CEPI did with the COVAX marketplace is amazing, and it's only too bad that they didn't get the support to do it kind of earlier in the pandemic. I mean, the folks there are just incredible. So thanks, Scott, for helping to shepherd that. On the data side, I think, the way I think about it is, and I understand business confidential information, but on the other hand, anything that crosses a border gets logged in these bills of lading data, which then is ultimately out there, which then ultimately somebody has access to, and you can pay these companies to provide it for you. So it's available. It's just a question of who has access to the information. And my fear is the US government is kind of oftentimes the only one that lacks access to this information. And so would we rather create a system where the US government is Scott maybe indicated, the trusted broker of some of this stuff, or where everybody has access to key pieces of information and is on a level playing field versus some folks that are willing to pay for it have access to it, and others aren't, and especially the ones who aren't are the government policymakers that are tasked with shepherding, resilience and responsiveness and global public health in times of crisis like this.
I think we might have lost Lee for a minute. Alistair, did you have a question?
Yeah, I've really got two questions. One is to all of the excuse me, speakers. If you were given your wish for what you would get to improve the resilience of the supply chain, what would it be? Give us your two dreams, not with restrictions, not if you were God and you can get this done, what would you ask for? And the second thing is, which really comes back to what Chad just said, and he maybe said it better. What are each of your objections, if any, to visibility and transparency in the supply chain?
I can go first. So as far as sort of what would be most valuable in the supply chain in sort of creating greater resiliency, I think keeping the global nature of the supply chain open. So don't do anything that would impact the value of a globally diverse supply chain, at the same time while promoting incentives that would encourage greater US manufacturing. And things such as, really the most important, again, when you look at the marginal cost differential between what it costs to produce many of the medicines on the essential medicine list here in the United States versus overseas and lower cost markets, you're going to need some type of subsidization from the government. So what would be important is to have long-term price and volume contracts where the government commits to a certain price and a certain volume over a certain period of time. So if those companies build that manufacturing capacity here in the United States, they know they're not going to be undercut by a less expensive imported product the day after they open the plant or a new line that was added. So I think it's keep the global market operating effectively and efficiently, and provide effective government support and long-term predictable marketplace for those products that are made here.
But just before we go on to the next question, these comments seem directly opposed to one another. Am I misunderstanding them? If you're keeping the global market open and at the same time you're going to subsidize US manufacturing, aren't these in conflict?
What I would say is I think there's a clear recognition that there is a political will on both sides, Republicans, Democrats in Washington, to see more US manufacturing. I think there's probably also, for essential medicines, a value in having more of that in the US. But essential medicines, I think on the FDA list, there were 220 products. The number of products approved by the FDA, I think, are 10,000 plus. And so it's for the vast majority of products, making sure that the market can operate effectively and efficiently with doing what we can to remove any trade barriers, whether it be export or increased tariffs, export barriers or increased tariffs. And so I would say there may be somewhat tension, but between those two, but I think it's recognition that for certain products, there's value in having them manufactured here in the United States.
Matt, did you want to raise that question with our panelists?
Sure. I'd be happy to. I guess, I'm not an expert in this area. And I've been trying to figure this out since the start of our project here. Is there any evidence that onshoring actually works, in the sense that, like, we've got things that are produced and, primarily manufactured in the US and others that are not? Is there greater reliability of US manufactured products? My sense as a clinician dealing with drug shortages is it doesn't seem to matter that much, that there are other factors that lead to shortages, and that production facilities in the US are not necessarily the big, you know, the big determinant of whether we're going to see a shortage for that product or not.
I mean, I think in the vast majority of cases, I would agree with that. I think, as I mentioned, there's sort of the political push right now to have greater US manufacturing. I think one area is where it does arise, and we're seeing this right now in terms of shipping delays now. And this is hopefully a very momentarily blip in the efficiency of getting products on cargo ships and into US ports, but we are seeing a situation where you know, there's delays in access to containers, delays in getting products on boats, getting off boats through customs. That is maybe one small place that, and as of now, that's not contributing to shortages. We hope it won't going forward. But I think what it can do, having a more robust manufacturing base in the United States for those essential medicines, is for that fill finish process, and for the small number of products where API is here, you can cut the time between production and when it accesses the patients. And if there is any disruptions in certain overseas markets, you have somewhat of a backstop. And I think that's why that globally diverse supply chain, and I think it was Carter who mentioned in the panel before, is you can't have reliance in any one market. So you don't want to see all the products for that particular, all the production for that particular medicine be here in the United States. But the US can support the production of some of that medicine for the US marketplace. So.
My favorite examples on this, and you know, this is all just anecdotes, of course, but when you're coming to you know, it's not obviously API, but when you're coming to vaccines, you know, obviously the most successful one that everybody has in mind is Pfizer, but that's not an American product, right? That's BioNTech's invention. If we didn't have globalization and supply chains, we wouldn't have those Turkish immigrant scientists in Germany giving us the world's most successful vaccine. The Johnson & Johnson vaccine was co-developed between, you know, Beth Israel and the R&D labs in the Netherlands. And with the fiasco of its production in the United States, just imagine if we'd only had that, right? Despite the fact that that was actually kind of good advanced pandemic planning to have that facility set up and to try to trigger it, and in real time, it just didn't work. And we were then reliant on what Johnson & Johnson we could get coming out of the Netherlands. Moderna, yes, an American invention, but had no production capacity, so was ultimately manufactured by a Swiss CDMO, yes, in New Hampshire facilities. But in any case, these things are global. And this is just kind of the reality that we confront. And that diversification, I think, in this instance of the pandemic, has helped us just as often as we can come up with examples for where it may have hurt us. And I think those are important to keep in mind.
Totally echoed. And just a quick reminder, the places where it feels like it may have hurt us often had positive spillover benefits to us as well, right? Like if what happened is we were enabling vaccination in some other country, that's, you know, reducing the emergence of new variants that come back to hurt us.
Yeah, I think I don't know that we've pulled those out, but it strikes me that those examples might be really useful of places where actually diverse supply chains across multinational arenas are actually stronger.
Very good points to note. Let me apologize to everyone on the call for the momentary loss of the internet here at Carnegie Mellon, you know, where the internet was partly invented. I guess maybe it's not my fault, but somehow I still feel the need to apologize. We are coming to the end of our time, and we only just have a few minutes left. You know, any members of the committee have any final questions for our panelists? All right, well, let me invite the committee staff. You know, if they feel that any point has not been, you know, explored, or if there's anything that we need to obtain before we all go away, now's a good chance to give us those reminders.
Great, thank you, Lee. This has been a really fantastic discussion. I just wanted to reiterate Lee's thanks to all of the speakers for taking the time to share your perspective on these important issues. A reminder that if any of the panelists would like to share materials with the committee, we welcome that. Just know that those materials will be made publicly available through our project public access file. So that's to ensure that the National Academies complies with Section 15 of the Federal Advisory Committee Act rules. And with that, I'll hand it back to you, Lee, to adjourn the open session.
Okay. Yeah. So Scott, we'll get back to you with the email address for sharing materials. Thanks for that. Again, thanks to all of the panelists, and also thanks to my fellow committee members for engaging in this important discussion. We really appreciate it. Thanks so much. And everybody have a great afternoon. So long.
Thank you.
Thank you very much.